Massachusetts is in desperate need of healthcare workers. The industry had nearly 50,000 unfilled jobs at the beginning of the year. That's more than 17,000 of them being registered nurses. And of the positions that are filled, the vast majority in patient-facing and leadership roles are white. And that can have some serious health impacts on patients of color who have long experienced a very different healthcare system than their white neighbors. A state program known as M-A Repay aims to tackle both of these problems by paying off student loans for healthcare workers. I'm joined now by Michael Curry, President and CEO of the Massachusetts League of Community Health Centers, which runs the M-A Repay program on behalf of the state, and Dr. Cheryl Clark, Executive Director of the League's Institute of Health Equity Research, Evaluation, and Policy. Welcome to you both.
Glad to be here.
So, Michael, talk to me first about this program, because this is extraordinary, $300 million here.
Yeah. So one, credit to the state legislature. You know, we complain about Massachusetts, but we should be thankful we're in Massachusetts. Not every state is putting their money where their mouth is. We know that there are shortages in various areas in the health profession, but Massachusetts' legislature was wise enough to put up money to focus on recruitment and retention, particularly on retention. Post-COVID, we knew there was a mass exodus from the profession. People were burnt out, were deciding that they wanted to no longer work as physicians and nurses and others. And they put up money, and that money cumulative total is over $300 million. And it resulted in a program we now call M-A Repay, a loan repayment program that really positions people to stay in their jobs, right? So we can help you defray the cost of a legal education so that you can focus on building wealth, paying off a home, and all those critical things that we want to focus on. Then you could stay in that job as a nurse or a doctor, a social worker, substance use disorder clinician. So huge credit to Massachusetts and the Maura Healey administration.
Especially, I think the retention piece is huge, because Massachusetts, we all know, is in a housing crisis. I mean, we did a transportation story where there were some doctors that are commuting from Worcester just to be able to pay for housing and then work in the city of Boston. So to have these supports already in place as they're in their positions being hired into these healthcare roles is huge.
Yeah, we travel the state as a Mass League, and we go visit health centers across the state, tour, and Dr. Clark and I have been on this tour along with my entire leadership team. And one of the things we hear at every health center we visit in every community from here to Berkshire's is we want to recruit providers, but we can't get them to stay or accept our offer even when we pay them competitive because of housing, because they want to build wealth, because they got to be paid a certain amount of money that may not compete with some bigger systems. There's a lot of issues involved in this, but when you can offer people loan repayment, and then they can also match that against the mission of the organization and say, you know what, I want to serve the mission, even though I won't be super wealthy out of this. We're finding that providers are making that choice. They're going to Western Mass. They're coming to communities of color and serving in our high-need communities across the Commonwealth. So there's a real clear benefit of loan repayment. And I'm, again, thankful to the Commonwealth for being a leading state with investment.
Yeah. Doctor, talk to me about what you're seeing in your role.
Absolutely. And so it is so important, these loan repayment programs, in terms of diversity. I think there's a statistic that's important to keep in mind. Only about 5% of physicians across the country, for example, are African American. So when you think about loan repayment programs, it really allows us to make sure that our workforce reflects who we are and that we have a diverse group of people with the lived experience to take care of diverse populations.
Especially when you're thinking about medical school loans, right? It's not, forget about college loans, which we're hearing that some universities are charging upwards of $90,000 nowadays. But if you're going to medical school, that means you've gotten a bachelor's degree, sometimes a master's degree, your medical school, and then you're not making a ton of money right off out of college.
That's exactly right, and it also constrains your choices. So what sort of specialty can you go into? And we know that primary care, for example, the doctors that kind of take care of all of you, your high blood pressure, all those sorts of things, they're paid a little differently, paid less than people who go into specialties. And so as we think about making sure that we strengthen our workforce, strengthen our primary care workforce, loan repayment is important because it opens up the choices we can make in terms of the specialties we go into.
And just as an example, primary care providers, which there's a shortage, there's a crisis of primary care, which is why people are waiting so long to be seen, can be paid $100,000 to $400,000 less than specialty. So we know there's shortages in specialty care, and they're experiencing that same thing. But imagine primary care, and you've heard me say this before, pay now or pay greater later. You want a primary care provider who keeps you healthy, who can identify your disease at an earlier state and get you into the right care at the right time for the right cost. And unfortunately, we're not investing. Only 6% of our spend in the Commonwealth is going to primary care. But what encourages me about this is we're now, as a pot of this $300 million, a good portion of that money is now going to recruit or at least provide reimbursement for an education for those primary care providers. So this way, they'll not have an incentive to go into specialty care. They can stay in primary care and behavioral health care. So that's really encouraging that we're investing in that.
Yeah, and I mean, we have data that really shows why this is so important. We have the percent of workers at acute care hospitals in Massachusetts, like emergency rooms, urgent health care, those kinds of places, who identify as white, non-Hispanic. 86% are nurses. 71% of the physicians, 80% of leadership, they identify as white. And so if I'm a person of color and I walk into these spaces and I see someone that doesn't look like me, I might be concerned about what my level of care will be. I'll share that I was at a sickle cell event, and a lot of those folks, the majority of people with sickle cell are black folks, and they go into these spaces and they're seen as just people who are pain relief seeking or just want drugs and things like that. So I think having this particular pot of money to be able to change those outcomes is super important, right?
Yeah, well, and Dr. Clark can speak to this much better than I can, but I'll say this. So I always say that there's a black woman somewhere, black girl in Roxbury that would be a Dr. Clark that's meant to find a cure for cancer, but we'll never know her because she didn't have the moral support, she didn't have the academic rigor, she didn't have the STEM programs to put her in that, but she may not have had the money to pursue that education. And we're all paying for it because she was meant to find a cure for cancer. If we can detach ourselves from this notion that only a small demographic of America should be in medical school. So to your point, there's also studies that are showing that that outcome is better in communities for people of color when there are physicians, providers of color. That data is evolving. It's here and across the country. That says something. When I speak your language, and by the way, if you're a black woman, I believe your pain, right? I recognize your struggle. I identify your faith being a part of your medical needs. We got to get to that where we identify that diversity matters in our medical profession.
Yeah. Dr. Clark, I'd love you to say more about that.
Yeah, no, absolutely. And so there are studies that show that particularly infants tend to live longer. And I don't think that we understand, the full story behind that, but they do tend to live longer or have better outcomes when they're acutely sick, when they are taken care of by people who look like them. And I think it's an important point to raise as well. You don't know who you are going to connect with. There may be someone who has an experience and maybe they look like you, maybe they don't, but just having a diverse workforce increases the likelihood that you're going to meet that person who you can make that personal connection with. And so very important to do that.
I imagine also among your colleagues in talking about the availability of these funds, they're more eager to say to perhaps their siblings or their children, yeah, you can be a doctor, don't worry about the loans, at least in Massachusetts. And that makes you more apt to encourage folks to enter the profession, right?
That's exactly right. I would say it's actually personal. Yeah. So I did not get a Massachusetts loan repayment, but I did receive a loan repayment program from the National Institutes of Health. And you may know that only about 1% of the investigators who were able to conduct research related to health happen to be African Americans. So it was extremely important, even just personally, to have that resource, and it led directly to the work that I'm doing now.
Yeah, that's so important. Well, certainly this is something we're going to be watching, and we're so glad that this work is happening. Thank you so much, Michael and Dr. Clark.
My pleasure.